Amazing mamas to be and curious minds. Welcome back to our channel. If you're pregnant or planning to be, you know your body goes through some incredible changes. And one topic that often pops up, but isn't always openly discussed, is vaginal discharge. Yep, we're talking about it today. It might sound a bit TMI, but understanding your discharge during pregnancy is super important for your health and your babies. So, let's dive in. First things first, what even is vaginal discharge? Think of it like your body's natural cleaning crew. Your vagina and cervix have glands that constantly produce fluid. This fluid acts like a gentle river, carrying away old cells and unwanted bacteria. It's how your vagina stays clean, healthy, and helps prevent infections. It also helps maintain a healthy pH balance down there, which is naturally a bit acidic. Pretty cool, right? It's a sign your body is doing its job. Why more discharge during pregnancy? Now, if you're pregnant, you might have noticed a definite increase in this discharge. And if you have, breathe easy. It's completely normal. So, why the boost? It comes down to two main things happening in your amazing pregnant body. Hormone surge. Pregnancy brings a massive increase in a hormone called estrogen. Estrogen basically tells those glands in your vagina and cervix to ramp up their fluid production. More estrogen, more discharge, increased blood flow. Your body also sends a lot more blood to your pelvic area during pregnancy. This extra blood flow means more fluid seeps into the vaginal walls, adding to the overall volume of discharge. This increased, normal discharge during pregnancy has a fancy name: Leukorrhea. It's your body creating an extra protective barrier. It helps guard against any nasty bacteria trying to travel up into your uterus, keeping your baby safe and sound. What does normal pregnancy discharge look like? So, you've got more discharge, but what does normal leukorrhea look like, smell like, and feel like? Let's break it down. Consistency. It's usually thin, clear, and can sometimes look a bit milky or creamy. Color. It's typically white, off-white, or maybe a very pale yellow when it dries on your underwear. Smell. It should have a very mild smell, or absolutely no smell at all. It definitely shouldn't be strong or unpleasant. Feeling. Most importantly, it shouldn't cause any itching, burning, pain, or discomfort. This normal discharge can actually start super early in pregnancy, sometimes even a week or two after conception, before you even miss your period. And it usually continues right through to delivery.
When to call your doctor. Red flags. Okay, this is the most important part of this video. While increased discharge is normal, there are times when it can signal a problem that needs medical attention. These are your red flags. If you notice any of the following, please don't hesitate to call your doctor or midwife right away. Change in color. Green or yellow. This is often a sign of infection. It might also look murky or pus-like. Gray. Also a common sign of bacterial infection. Bloody or brown. While a tiny bit of spotting can sometimes be normal, especially early on or after an exam, any significant amount of blood, or persistent brown discharge, which means old blood, needs to be checked out immediately. It could indicate a miscarriage or other serious issues. Don't take chances. Strong or bad smell. Fishy odor. This is a classic sign of a bacterial infection called bacterial vaginosis, BV. It often gets worse after sex. Yeasty, bread-like odor. This can point to a yeast infection. Any other foul or strong smell. Changes in consistency. Frothy or foamy. If your discharge looks bubbly or foamy, especially if it's greenish yellow, it could be an STI called trichomoniasis. Thick, lumpy, cottage cheese-like. This is the telltale sign of a vaginal yeast infection. Accompanied by other symptoms: intense itching, burning, or redness. These are major red flags, usually pointing to an infection like a yeast infection or an STI. Pain during urination or sex could indicate an infection. Abdominal pain or pelvic tenderness. especially if combined with abnormal discharge. This needs urgent evaluation. Sudden gush or continuous leakage. Clear, watery gush. If you feel a sudden gush of clear, watery fluid, and it keeps leaking, this could mean your water has broken. Call your doctor immediately, no matter how far along you are. Don't wait.
How to manage normal discharge during pregnancy. Okay, so you've identified your discharge as normal. Now, how do you manage that increased wetness and stay comfortable? Good hygiene is key, but it's about doing it right. Wear cotton underwear. Cotton is breathable and helps keep the area dry. Synthetic fabrics like nylon can trap moisture and heat, which is a no-go for happy lady parts. Avoid douching. Seriously, just don't do it. Your vagina is a self-cleaning machine. Douching disrupts its natural balance of good bacteria and can actually increase your risk of infections. Keep the area clean and dry. Gently wash the outside, your vulva, with plain warm water daily. Change underwear regularly. Use panty liners. If the discharge is making you feel uncomfortable, change your underwear more often. Unscented panty liners are also your best friend. Just remember to change them frequently to avoid moisture buildup. And always choose unscented. Avoid tight clothes. Tight pants and underwear can trap moisture and heat, creating a perfect breeding ground for infections. Opt for loose-fitting, breathable clothing, especially skirts or dresses. No scented feminine products. This includes scented sprays, wipes, powders, or bubble baths. They contain perfumes and chemicals that can irritate sensitive skin and disrupt your natural vaginal balance. Remember, every pregnancy is wonderfully unique. What's normal for one person might be a little different for another. The most important thing is to listen to your body and never hesitate to reach out to your healthcare provider if you have any concerns at all. They are your best resource for personalized advice and care during this incredible journey. We hope this video has been helpful in shedding some light on vaginal discharge during pregnancy. If it was, please give us a big thumbs up. Share it with other mamas to be, and be sure to click that subscribe button so you don't miss our next video. Thanks for watching, and we'll see you next time. Bye for now.